Welcome to the MS-Perspektive podcast, Perspective with a K as I'm German. I'm Nele von Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in again and welcome to episode number 72, Natalizumab or Tysabri and Tyruko for active relapsing remitting MS. Today we are talking about Natalizumab, which is known under the trade names Tysabri and Tyruko. The immunotherapy is used for active severe courses of relapsing forms of MS. Natalizumab is a migration-inhibiting drug that prevents the migration of T and B cells into the central nervous system. Please remember that I can only provide an overview here. Your neurologist and your MS nurse should give you detailed advice on choosing the right therapy for you. This is because they know your overall state of health, and you should also talk about your goals, wishes, fears and preferences so that these can be taken into account. As always, I want to start with general information. To get a good overview of the major topic of therapy decisions, I recommend that you first listen to episode number 58, Immunotherapy in MS, a guide to efficacy and choice with Professor Dr. Tjalf Thiemsen. There you will find out why you can only compare the various disease-modifying drugs to limited extent. It is important to start an effective therapy quickly, why MRI and other examinations are important for assessing progression and provide information about effectiveness, why therapies should be changed as little as possible, but of course if they are not effective enough, why in most cases it is better to start with a highly effective therapy and only switch to a lower category at an advanced age, why in the case of highly active MS it may be more important to start immunotherapy quickly and tackle rehabilitation at a second step, why generics and biosimilars are being used more and more and which approval requirements they have to fulfill, why the risks and side effects of a therapy must be differentiated into unpleasant side effects at the start of therapy and rare possible risks, and these must be set in relation to the usually irreversible effects of untreated MS in the long term, why it is important to honestly discuss your opinion, wishes, goals and fears with your neurologist in order to make treatment decisions together that both sides can agree on, why it is advantageous to be cared for by MS specialists and to stay informed yourself in order to benefit from new findings and treatment options, and why you should contribute to a favorable prognosis with your own healthy lifestyle. Another general note. The approval studies for the individual drugs were carried out at very different times. 30 years ago, you have to be more severely affected or more advanced in the course of the disease to receive a reliable diagnosis of multiple sclerosis. Less severely affected people were probably not diagnosed or not diagnosed at first. With ever-improving examination methods such as MRI, even small lesions in the central nervous system can now be seen better. Furthermore, 30 years ago it was not yet known that neuromyelitis optica spectrum diseases, NMOSD for short and MOGAD, are separate diseases that require their own therapies and sometimes even react negatively to MS medication. They were previously thought to be multiple sclerosis, and MS therapies did not alleviate the disease activity. So let's dive into the medication. How is Natalizumab, Tysabri and Tyruko classified in immunotherapies? There are currently 3 different therapeutic approaches for the preventive, i.e. disease-modifying therapy, DMT, of multiple sclerosis. The most unspecific is immunomodulation. Migration inhibition already narrows down the path, which also includes Natalizumab, and the most specific is a depletion of immune cells. The DMTs are listed in alphabetic order. Immunomodulation, the therapies weaken the immune system. They have a very broad effect via various factors, e.g. on Th1, T17, Th2, Treg, antigen presentation, as well as on different signaling pathways and possibly via other mechanisms. They attempt to shift the milieu from inflammatory to non-inflammatory. Dimethyl fumarate, known as Tecfidera in generics, and diroximel fumarate, known as Vumerity, glatiramer acetate, known as Copaxone, Brabio, Clift, or other names, interferon beta with interferon beta 1a, known as Evonex and Rebif, interferon beta 1b, known as Betaferon Extavia, and PEC interferon beta 1a, known as Plegridy, teriflunomide, known as Aubagio, and now we are already in the migration inhibition. The migration of certain immune cells is inhibited. Natalizumab with Tysabri and Tyruko, S1P modulators with fingolimod Gilenya, ozanimod Zeposia, ponesimod Ponvory, and ceponimod Mayzent. And the third level, cell depletion, developing immune cells die off. The depletion of T cells, B cells, natural killer cells, and monocytes with alemtuzumab, known as Lemtrada Campes. T and B cell depletion with cladribine, known as Mavenclad Loistat Litakine. And B cell depletion with ocrelizumab, known as Ocrevus, ofatumumab, known as Kesimpta and Bonspre, rituximab, known as Meptera and Rituxan, and ublituximab, known as Briumvi. What is Natalizumab, Tysabri and Tyruko approved for? Natalizumab is approved for the treatment of active severe forms of relapsing remitting MS, or RRMS for short, that are rapidly progressing. The German Multiple Sclerosis Competence Network, KKNMS, and the German guideline recommend its use in patients aged 18 and over who still show disease activity after a sufficient startup period of another disease-modifying therapy. In addition, patients aged 18 and over with rapidly progressing severe RRMS can also be treated with natalizumab from the outset if 2 or more relapses with disability worsening have occurred in 1 year and MRI of the head shows at least one new gadolinium-enhancing lesion or a relevant increase in T2 lesions compared to a recent MRI scan. In other words, an existing inflammatory activity is detectable. Different information or recommendations are possible from country to country. What is the situation for special patient groups? Let's start with teenagers and children. Natalizumab, Tysabri and Tyruko can currently only be used off-label in children and adolescents. In a retrospective study by Hubke et al. From 2019, which included 144 children and adolescents, 42% or 55 patients had highly active MS and received natalizumab. This led to a 95% reduction in relapse rate and a 97% reduction in MRI activity. For an individual consultation, please contact an MS specialist, preferably a neuropediatrician. Let's come to pregnancy and breastfeeding. In the approval studies, their follow-up in the German MS Fertility Register and an Italian study in which natalizumab was taken until the onset of pregnancy, the miscarriage rate was within the usual range and so was the rate of malformations. There was also no particular pattern of malformations. A total of 650 pregnancies have been documented to date. On average, the children had a slightly reduced birth weight. If natalizumab was continued beyond the first trimester of pregnancy, 36% of the children developed anemia or thrombocytopenia, which according to the current status remained harmless and without consequences and were no longer detectable after a few weeks. The data is based on 122 newborns recorded as part of the German MS and Fertility Registry. Natalizumab passes into breast milk in very small quantities. In a small sample of 20 women from the German MS and Fertility Register, no health effects on the infants were found. The probability of natalizumab being absorbed via the infant's gastrointestinal tract is low. What are the recommendations of the European EMA and American regulatory authorities FDA? Natalizumab, Tysabri and Tyruko, should only be used in pregnancy after a strict risk-benefit assessment. The active substance can be detected in breast milk. The data on possible effects on children who have been breastfed with natalizumab are still insufficient, which is why breastfeeding with Natalizumab, Tysabri and Tyruko should be avoided. There are also recommendations of the DMSKW, the German MS Fertility Register. Recommendations are based on the current data situation and experience of the DMSKW. Natalizumab, Tysabri and Tyruko should not be discontinued before a planned pregnancy without alternative therapy. If no alternative therapy is available, the DMSKW advises, after intensive risk-benefit assessment, to continue Natalizumab through pregnancy. This should take place in experienced multiple sclerosis centers. The infusion intervals should then be extended to 6 to 8 weeks. When the last infusion is given, must be discussed with the treating neurologist. If the last infusion is given before the 30th week of pregnancy, preliminary data from our register shows that around 40% of women still suffer a relapse after giving birth. If the last infusion is given after the 30th week of pregnancy and Natalizumab therapy, Tysabri Tyruko, is started again within the first 4 weeks after delivery, the risk of relapse is low, only 12%, but more blood count abnormalities occur in the children, approximately 60%. Who should avoid Natalizumab? Persons who are hypersensitive to the substance or other ingredients. Patients who currently or in the past have suffered from progressive multifocal leukoencephalopathy, PML, persons at increased risk of opportunistic infections due to immunodeficiency, whether due to current or previous treatment or HIV infection. Furthermore, patients should avoid Natalizumab if they have active malignancies, unless it is a basal cell carcinoma. Under the age of 18, Natalizumab, Tysabri and Tyruko should only be used after a careful risk-benefit assessment and only under the guidance and supervision of an experienced MS center. How does Natalizumab work? Natalizumab does not trigger cell death, but prevents the adhesion of immune cells to the vascular wall and thus ultimately the crossing of the blood-brain barrier. The effect on the immune system is neither organ-specific, i.e. the migration of immune cells into other organs, such as the intestine, is also inhibited, nor selective for autoreactive immune cells. Therefore, immune cells that fight specific pathogens are also prevented from migrating. Due to the mechanism of action, patients treated with Natalizumab tend to show higher leukocyte counts in the peripheral blood. After discontinuation of the drug, these cells can rapidly migrate into the central nervous system, CNS, and possibly lead to recurring disease activity. How is it taken? Natalizumab is available as an intravenous infusion known under the brand name Tysabri, and since 2023 also as a biosimilar known as Tyruko. Tysabri has also been available as a subcutaneous injection since 2021. Natalizumab is administered intravenously as a 300 mg infusion every 4 weeks. Dose adjustments according to weight, gender, or ethnicity are not necessary. The subcutaneous injection is given at a dose of 300 mg divided into 2 injection sites every 4 weeks, whereby the injection sites should be at least 3 cm apart. The interval can be extended from 4 to 6 weeks to reduce the risk of PML. However, this should only be done by experienced MS centers. In the first few months, permanent neutralizing antibodies may also develop, which can lead to the drug being excreted threefold. This occurs in around 6% of all patients in the first 3 months, rarely later than 9 months. How effective is Natalizumab, Tysabri and Tyruko? Gavin Giovannoni, an MS expert from the UK, has graded his MS selfie cards on a scale of 1 to 10, with 1 being low efficacy and 10 being maximum efficacy. In his estimation, Natalizumab, Tysabri and Tyruko, scores 8 for preventing relapses and 8 for avoiding long-term disability. It should be noted that Natalizumab is effective in many people, but not for the ones that create antibodies. In the pivotal study, Natalizumab led to 68% fewer relapses and slowed disability worsening by 42% compared to placebo. In other words, you can also look at 100 patients. 46 of these patients remain relapse-free, even on placebo. In the Natalizumab group, a further 26 patients remained relapse-free. Looking at the same 100 patients, 71 remained at the same level of disability as measured by the EDSS, Expanded Disability Status Scale, during the pivotal trial period, including the placebo group. 12 people in the placebo group deteriorated who remained stable on Natalizumab. Let's talk about the risks and side effects of Natalizumab, Tysabri and Tyruko. The most common side effects of Natalizumab are infusion reactions, such as dizziness, nausea and vomiting, a sore throat and itchy skin, fatigue, infections and allergic reactions. In patients who are carriers of the JC virus, there is a risk of severe brain infection known as progressive leukoencephalopathy, PML, which increases with long-term use of the drug. The risk is around 0.4%. So, what safety precautions and lab parameters are important? A clinical neurological examination must be carried out every 3 months. The blood count must be determined every 3 to 6 months. Before each Natalizumab infusion or injection, a clinical check must be carried out to determine whether an infection is present. If this is the case, the medication cannot be administered. If too few white blood cells, known as leukopenia, or too many, known as leukocytes, are measured, a differential blood count must be performed. The liver values must be determined within the first 3 months after starting therapy, and then every 3 months for the first 6 months. If clinical signs of liver dysfunctions are detected, they must be checked accordingly. If certain liver values become too high, treatment with Natalizumab must be paused until the values have returned to the normal range. Subsequently, close monitoring is required. If certain liver values rise again and are above 5 times the normal value, Natalizumab must be permanently discontinued. The JC virus, JCF-AC index, should be determined every 6 months in order to better assess the individual risk situation for the development of PML. After the basis MRI with contrast medium at the start of treatment, an MRI of the brain should be performed annually, i.e. every 12 months without contrast medium unless there are reasons for contrast medium administration. More frequent MRI examinations every 3 to 6 months may be useful if there is a corresponding risk constellation. If possible, the MRI examinations should be performed on the same machine and with the same sequences. The infusion takes 1 hour and the follow-up takes a further hour. 1 hour of follow-up observation also applies to the injection. Therapy must be discontinued immediately if there are signs of PML beginning. You do not need to worry about this, it will be checked for you. However, please take the test seriously and make up for them if you are unable to keep an appointment, and don't skip them altogether. On the MS selfie card mentioned earlier, the side effects are rated on a scale from 1 for few or rare to 10 for many or frequent as follows. Regular side effects at 3. Long-term side effects at 5. Cancer risk at 7. Natalizumab receives the following rating in the MS selfie card overview of the effects of therapy. Clinical visits, moderate. Family planning, compatible. Vaccinations, moderate response. Let's talk a little bit more about vaccinations. Live vaccines should be avoided and only administered after a thorough risk-benefit assessment. All other vaccinations are permitted during treatment with Natalizumab, Tysabri and Tyruko. In general, the effectiveness of vaccinations may be limited during and up to 3 months after discontinuation of Natalizumab. Vaccination against herpes zoster, which leads to shingles, is recommended for patients with immunotherapy from the age of 50. In this case, vaccination with the inactivated Shingrix vaccine is recommended. Finally, let's talk about sources. I used the following sources to create the content. The lecture on Natalizumab by Professor Dr. Thomas Berger as part of the Multiple Sclerosis Management Master's Program, the quality manual of the German KKNMS on Natalizumab, Tysabri and Tyruko, the MS Selfie info cards by Professor Dr. Gavin Giovannoni, the German Multiple Sclerosis and Fertility Registry, DMSKW, information from the German interview with Professor Dr. Barbara Kornick on pediatric MS, and the German DECIMS information on Natalizumab. One final note. Please remember there is no one great medication that helps everyone, but it must always be weighed up what suits a particular person best. Other illnesses, personal goals and preferences must also be taken into account. Your neurologist and MS nurse are the right persons to talk to and can make individual recommendations. This podcast is for information purposes only and does not constitute your recommendation. What helps one person may not help another. I hope that together with your neurologist and MS nurse, you will quickly find the right immunotherapy for you, and that you can lead a fulfilled, happy and self-determined life with MS, supported by a healthy lifestyle and a dose of fortune. By the way, you may also want to listen to the following episodes. Number 61, dimethylfumarate, Tecfidera and diroximel fumarate, Vumerity. Number 65, glatiramer acetate, Copaxone, Brabio, Clift. Number 68, interferon beta, Avonex, Betaferon, Extavia, Plegridy, Rebif. And number 70, teriflunomide, Obagio. I hope you enjoyed the episode and learned something new about this option of a disease-modifying therapy. By the way, next time it will be about a MS patient again. Si se puede, Chris' journey of invisible battles and visible triumphs as Latina with MS in the US. Crystal Bedoya is a digital content creator, a freelance writer, and she lives in Yuma, Arizona in the United States. Chris is very active on Instagram and shows her life. Her life despite MS, her life with MS and what it means. And she has always more or less a very good mood, which is great. And so I think it's really worthwhile tuning in again, and I hope to hear you next time. Bye-bye. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. Hear you next time.